During my medical school, I was fortunate enough to do some rotations at University of Wisconsin in Madison. And the culture of being very helpful and kind and always being a big advocate of education and doing work-life balance, which is equally important, was something that always attracted me to come back to Wisconsin. When the time came to apply for residency, I was looking for a program in a rural setting because that was where my interest was. And I applied to Mercyhealth Lake Geneva Rural Track Program and was fortunate enough to get accepted.
I'm passionate about training rural residents as there is pride involved knowing that after this training, they will be able to practice medicine in any setting. During this residency program, the residents will have vast opportunity to learn clinic medicine, hospital medicine, procedures. They will have experience in general surgery, cardiology, pediatrics, OBGYN, and other specialties.
As a rural community, patients will come to see you more often, not just for common colds, but also a variety of other medical conditions such as mental health, sometimes for cancer, sometimes for urgent care. And if you're working in an urban area, a lot of times primary care physicians may tell the patients to go to other specialties. But here in the rural area, you as a family medicine physician are responsible to take care of the patients, and that's a great learning opportunity for me as a resident.
I think the culture of the program is very open, it's friendly. Everybody from the physicians to the allied healthcare workers, they have a very optimistic attitude of learning.
So the benefits of Lake Geneva program is that it is still a new program. I as a resident can contribute new ideas to the program director.
The fact that it's a small program with 2 residents per year gives us opportunities to work very closely together on a daily basis, both in the hospital as well as in clinic and other settings.
Another fact was that this program was heavily emphasizing outpatient clinic, and my passion is doing outpatient work. So doing continued care throughout my residency years was very much attracted to me.
The program also gives us a lot of autonomy, especially in the outpatient clinic, where we are able to diagnose the patients on our own, but also our preceptors, they encourage us to do procedures, they encourage us to make our own treatment plan. Those are the things that will make us become a strong rural physician in the long run.
What makes this program unique is the location. Lake Geneva is a wonderful area. It is a rural area, yet there is multiple opportunities here.
During my downtime, I enjoy running, and so I like to explore the nearby lake or the local trails.
Lake Geneva is a great place to live in because of the people. Even if I go to a grocery store or a coffee shop, it's interesting that I will bump into some of my patients over there.
And the community recognizes that you're very much invested in the well-being of the community by being part of living in the community that they're in. And so they develop stronger trust with you. Rural training is very much important to me because in the rural area, there's especially low number of physicians.
It's the rural health doctors who can actually go outside in the community and make sure that patients who don't have access to insurance, have language barriers, or who are unable to travel for long distances can be given optimized evidence-based healthcare at the right time. That's not only an indicator of patients' well-being, but I feel that's an indication of a community's well-being.
One of the goals of the residency program is to train physicians who will stay in Wisconsin and in Walworth County. Relationships that they're building with patients now will last lifetime.
After residency, I plan on staying here in Lake Geneva and providing care to the patients I have seen over the residency years. This program is preparing me to do that because of the continued care clinic where I get to see the patients even when I'm at different departments.
Completing Rural Track residency program, doctors should be able to work in any environment, in any setting, and they should be well prepared for future medicine.
And I believe the autonomy that this program has given me in case of my clinical judgment, clinical procedural skills, and also the vast diversity of cases that I get to see is something that will really allow me to work in any underserved community.